Erectile dysfunction, or ED, affects millions of men, causing significant distress and impacting relationships. Thankfully, effective treatments like Viagra and Cialis exist. These medications, known as sildenafil and tadalafil, belong to a class of drugs called phosphodiesterase type 5 inhibitors. They work by enhancing the effects of nitric oxide, a natural chemical that relaxes the smooth muscles in the male organ. This relaxation allows increased blood flow, leading to an erection. It's important to understand that Viagra and Cialis don't automatically cause erections, they require stimulation. Think of them as facilitators rather than initiators. While both medications are effective, they differ in their duration of action and onset time. Understanding these differences can help men make informed decisions about which medication aligns better with their needs. Consulting a doctor is crucial to determine the appropriate treatment based on individual health conditions and medical history. Erections are complex processes involving nerves, hormones, blood vessels, and psychological factors. Sexual stimulation triggers nerve impulses from the brain to the penis, initiating a chain reaction. Nitric oxide, released from nerve endings, relaxes the smooth muscles within the erectile tissues. This relaxation allows blood to flow into these tissues, causing them to expand and become engorged. As the corpora cavernosa fill with blood, they press against the veins, trapping the blood and leading to an erection. For the erection to subside, an enzyme called phosphodiesterase type 5 breaks down a molecule responsible for maintaining the smooth muscle relaxation. ED can occur when there's a disruption in any of these steps. Factors such as stress, anxiety, smoking, diabetes, and certain medications can interfere with the erection process. Viagra, the brand name for sildenafil, is a PDE5 inhibitor that works by blocking the action of the PDE5 enzyme. By inhibiting PDE5, Viagra allows cGMP levels to remain elevated, prolonging smooth muscle relaxation and enhancing blood flow. This helps men achieve and sustain erections when sexually aroused. It's important to note that Viagra doesn't directly cause erections. It enhances the body's natural response to sexual stimulation. Viagra is typically taken orally, approximately 30 to 60 minutes before sexual activity. Its effects can last for about 4 hours, providing a window of opportunity for intimacy. The recommended starting dose of Viagra is 50 milligrams, adjustable by a doctor based on individual response. It's crucial to follow the prescribed dosage and avoid exceeding the recommended amount to minimize the risk of side effects. In this section, we're going to delve into Viagra versus Cialis, choosing the right option. While both Viagra and Cialis are effective PDE5 inhibitors, they have distinct characteristics. One significant difference lies in their duration of action. Viagra typically lasts for about 4 hours, while Cialis can remain effective for up to 36 hours. This earns Cialis the nickname, the weekend pill, as it allows for greater spontaneity. Another difference is their onset time. Viagra generally takes effect within 30 to 60 minutes, while Cialis can take up to 2 hours. The choice between Viagra and Cialis depends on individual needs and lifestyle. Factors to consider include the frequency of sexual activity and desired spontaneity. Consulting a healthcare professional can help determine the most appropriate medication and dosage. Now let's talk about side effects and precautions, using Viagra safely. Like all medications, Viagra can cause side effects, although not everyone experiences them. Most side effects are mild and temporary, resolving on their own. Common side effects include headache, flushing, indigestion, nasal congestion, dizziness, and back pain. Rarely, Viagra can cause more serious side effects such as priapism, a prolonged erection lasting more than 4 hours, and sudden vision or hearing loss. Before taking Viagra, inform your doctor about your medical history, including any pre-existing conditions. Viagra can interact with certain medications, including nitrates and alpha blockers. Combining Viagra with these medications can lead to a dangerous drop in blood pressure. Avoid grapefruit and grapefruit juice while taking Viagra, as they can increase the levels of sildenafil in the bloodstream. Use Viagra responsibly and as directed by your doctor, and seek medical attention if you experience any unusual side effects. Moving on to consulting your doctor. The first step to a solution. Experiencing erectile dysfunction can be concerning, but it's a treatable condition. The first step towards addressing ED is to consult a healthcare professional. A doctor can help determine the underlying cause of ED and recommend the most appropriate treatment approach. This may involve lifestyle modifications, medication, therapy, or a combination of these. Open communication with your doctor is crucial for effective ED management. With the right guidance and support, you can overcome the challenges of ED and enjoy a fulfilling sex life.